Reporting for the Ministry of Health and Social Development, I'm Public Health Communications Specialist Natasha Letson. Joined by us today, we have the Medical Officer of Health, Dr. Ronald Georges. We have the Deputy Chief Environmental Health Officer, Mrs. Yolanda Penn, and the Program Manager for Vector Control, Mr. Minchinton Israel. Welcome.
Thank you.
Thanks for having us here, Natasha.
Now, as the ministry continues its educational efforts to promote chikungunya as well as dengue within the territory, we're glad to have you on the program today to just clear up a few things and also to continue to educate the public of what we should be doing in order to curb its impact. Now, refresh our memory a bit as to what is dengue fever and chikungunya and how they differ from each other.
Okay, thanks again, Natasha. As you know, chikungunya and dengue fever are two mosquito-borne viral diseases. They're both spread by the Aedes aegypti and the Aedes albopictus mosquito. The Aedes aegypti mosquito is actually more important in the British Virgin Islands for transmission of these two diseases. Both, as I mentioned, are viral illnesses, which usually associated with a fever. The difference with chikungunya is that there's more association with arthritis or swelling in the joints and arthralgia, which is pain in the joints. Whereas dengue virus, there's more association with back pain, and perhaps some retroorbital pain, pain behind the eyes. So both are febrile illnesses. Both can cause severe illness. In the case of dengue, apart from the normal dengue virus, there's also dengue hemorrhagic syndrome, which can cause bleeding and can be life-threatening, and dengue toxic shock syndrome, which similar could be life-threatening. Chikungunya is slightly different in the sense that you may have long-term effects. As I mentioned, the arthritis, which is the swelling of joints and the pain in the joints, that can actually persist for a number of weeks after illness. And in some persons who are susceptible, it may even persist for a number of years. So the importance with chikungunya is really that it can be a debilitating disease, and it can persist for some time after persons have recovered from disease.
Okay, now I know for years the Environmental Health Division has educated us about dengue. We've now hearing about chikungunya within the last year. What can we attribute to this surge?
Well, the importance of chikungunya over the last year really is that it has now been introduced to the Western Hemisphere. This is a disease which primarily was in sub-Saharan Africa and Southeast Asia and made the trek over to the Caribbean, first being seen in St. Martin around Christmas time last year. And as we know, it's a global environment. There's a lot of travel of persons, and similarly now diseases can travel. So once chikungunya made fall in the Western Hemisphere, first in St. Martin, soon after that we actually got chikungunya here in the British Virgin Islands. We saw it first in Jost Van Dyke around the same time.
How would someone become infected?
As I mentioned, it is a mosquito-borne illness. So the virus is within infected mosquitoes, who then can bite a person, and then transmit that virus to the person. So as I mentioned, it's a mosquito-borne illness, and that is how it is transmitted.
Now, in terms of vector control and the role that the Environmental Health Department is playing, what type of strain has this virus placed on your resources?
This disease outbreak has put a considerable strain on the department in the way of human resources and the budget. We've had to make a request to the ministry for additional funds to be able to get equipment and the supplies that we need to do the treatments that we need to do. And as far as resources, we have our vector control team, and we have 6 members of that team that are out in the field, and they've had to be stretched to run to where the outbreaks would call for immediate attention. For example, Jost Van Dyke at first, and now Virgin Gorda. And these individuals are on the front line, so they would be at higher risk of being bitten by mosquitoes. And so if one of these men or two were to become impacted, then or infected, then we would have even less people to deal with. So that kind of prompted a call to the public, where we put out a call to the public for volunteers that would be able to be trained in the future to do some of the management of treating of waters and things like that to help us in controlling the mosquito population.
Mm-hmm. And I know one of the key messages of the campaign is to call for that community support,
Right.
because it takes the whole entire community in order to
Exactly.
mitigate and lower our vulnerability to this
Yes.
virus. But how did that call go? Did you receive any feedback in terms of
Yes,
where
yes.
we know?
We got some good feedback from that, and now it's just to find the time to do the training.
Mm-hmm.
We have asked that, for example, we are doing a focus on schools right now, fogging schools and doing treatment there. And we've asked the principals to supply us with the name of the maintenance person or whoever's in charge of the grounds, so that we can use that opportunity to train that person,
Great.
so that in the future they could be responsible for maintaining those grounds free of mosquito breeding.
Mm-hmm. Good stuff. Now, Mr. Israel, what makes the Aedes aegypti mosquito so important? Why are they the carriers of these diseases?
Well, I'll put it this way. Insect pests are important for the diseases they carry. As to the reason why they carry certain diseases, I leave it up to the imagination. But I'd like to address it from the standpoint of how difficult it is for us to fight the bite, so to speak. Here it is that we have a mosquito, Aedes aegypti, that breeds primarily in and around our premises. It's peridomestic. And there's a dependence on vector control, on government, so to speak, to manage and control mosquitoes. But imagine that the cycle of the mosquito from egg to adult is 1 week. Mm-hmm. It's impossible for any inspector to be out there at every premises to ensure that there are no containers with standing water breeding mosquitoes. And here's where the public must take control of their premises and be responsible for doing the weekly inspections in order to manage the situation. And this is the call that we're making to the public right now. Mm-hmm. And if we succeed in that, which may not be immediate, but if we succeed, what we expect is that folks will be calling in for assistance in managing a problem that they may have difficulty in managing themselves, but at least they would have done the inspections of their premises and would have found breeding places and would have dealt with them as best they can. Mm-hmm. So I will look at the question from the standpoint of the mosquito is important because it is a carrier of dengue fever and chikungunya, and that is impossible for us to manage the outbreak currently without the total support of the public.
Now, earlier, Mrs. Penn, you spoke about treatment. I think that people have the conception here that when you talk about environmental health, you're talking about fogging. So enlighten us a bit more, go a bit more in detail in terms of the work that you put in, the treatment, the surveillance, everything, so that we have a greater appreciation for the role that you carry out.
Right. Okay. Thanks for that question. It's an excellent question. And Mr. Israel may be able to add to something that I might leave out. But the surveillance is very important. We have the vector control guys going pretty much premise to premise and inspecting the property for mosquito breeding. So that's a part of it. And then again, when they find breeding, they would be able to apply whatever treatment would be required for that particular area. For example, it might be a cistern that's not properly covered, or a septic that's not properly covered, an open water storage, a barrel of water that a household is collecting for future use that could be breeding. And then based upon whatever waters are found, the appropriate treatment would be done for it.
I think if our people understand that fogging is a procedure whereby we are tackling the adult population of the mosquito, mm-hmm. those in the air flying around, not the aquatic stages in the containers. So that if we do a fogging run through a community, we are not killing the mosquitoes in the drums and barrels and tins and bottles and what have you. So if we understand that, we know that there has to be a collaboration. As householders, property owners, we take care of those containers so that when we kill the adults, then there is no way for mosquitoes to be emerging, as we say, from artificial containers to repopulate the community with the mosquitoes. So if we collaborate and we do our parts, then we can ensure that the density of the mosquito population, the number of mosquitoes in the air, will go down. And with less mosquitoes, then obviously the possibility of transmission goes down similarly.
Now, Dr. Georges, we've heard from environmental health in terms of their response. What has the ministry been doing?
Well, in terms of the Ministry of Health and the Central Ministry, it's really an idea of well, surveillance, monitoring, also ensuring that all of the healthcare providers in the territory are aware of the information. So pretty early on in the epidemic, a lot of information was circulated directly to healthcare providers on what is chikungunya, how to treat it, how to recognize it. There's also linkages with the Caribbean Public Health Agency, CARFA, which in the initial stages of the epidemic, of the outbreak, when we saw these first symptoms, these first persons from Jos Van Dyke, weren't quite sure what it was. We thought it was chikungunya. Had the sample sent off to CARFA for testing to identify that yes, this was chikungunya. And but as the outbreak has progressed, Jos Van Dyke has subsided somewhat, and then Virgin Gorda now is more active. We know that this is what it is. So the reliance on testing from CARFA is not as important, right? So I mean, at this stage, really the efforts are in terms of the ensuring healthcare providers are aware, monitoring the progress of the disease activity, and as Mr. Mitchington and Ms. Penn from Environmental Health have mentioned, the most critical thing right now is breaking the cycle of mosquito breeding. Because as we've discussed before, you have persons who become infected, who can then infect new populations of mosquitoes and continue to propagate this disease activity in the community. So really, we need to break the cycle of the mosquito life cycle, and then also ensuring that persons who are infected are protecting themselves as well. So for example, if you are infected in the early stages of infection, persons should, for example, be sleeping under bed nets. They should be using mosquito repellents and avoiding them from getting bitten by mosquitoes, because then basically what can happen is that you continue to transmit to the persons around you in your household and in your neighborhood. So those are some of the efforts that we're trying to do at this point in time.
Now, I'm glad that you mentioned Jos Van Dyke, because earlier in the year there was a massive campaign that was launched filled with interagency collaboration and collaboration within the community that proved to be very successful. Now, based on the lessons learned from that experience, how are we moving forward to help protect the other communities within the territory?
Right. From the Jos Van Dyke experience, we didn't achieve everything that we wanted to achieve, but I think we achieved a considerable amount, and a number of lessons were learned. And I think the most important thing was the need to collaborate with communities. The fact that government agencies, need to work together, because no agency can work independently and hope to combat an issue like this, but also the need to work together with the community. And I think the amount of community support we got in Jos Van Dyke, if you recall, was critical in turning things around there. So I think moving forward, we're looking at doing the same things with other communities, beginning to work with other communities. And this is part of the work that environmental health is really leading on.
And now we've noted that the Environmental Health Division has been conducting a number of community meetings. You're in Virgin Gorda, Caribbean, Jos Van Dyke. You have many more scheduled. Speak a bit to the level of interaction with the community and how they've been receiving the information.
Yes, I'll speak to that. The level of reaction from the community has been very good. Most of the meetings have been 35 plus residents in attendance, and it's an opportunity for a face-to-face interaction with government personnel that are dealing with this problem that many people are have suffered from. And it also allows a time for question and answer right there on the spot, and it's a very good time of information sharing, and so it's been very positive so far.
Now, in terms of Mr. Israel, how are we choosing the communities that we're targeting right now for these public meetings?
Well, there are two criteria. One would be the frequency with which residents are becoming infected. So we have records coming from the ministry end telling us that so-and-so has been infected in whatever community. So we know where the virus is circulating more than others. We correlate that information with our indices. Our indices are statistical measures that tell us exactly to what extent there is a lot of adult mosquito populations with the potential to spread the virus. So if we know that there is transmission taking place in one given community, and our indices indicate that there are enough mosquitoes to move that virus around from person to person, then we would be able to say that these are the areas that we should concentrate our resources on. So obviously, go into a community where you don't have those two combined criteria, would be a waste of resources when some other community might be in more dire need of our presence.
Mm-hmm. Now, in terms of some of the feedback, what have some of the feedback been from the attendees of the meeting?
Well, what you find from the community is questioning, for example, our role. And as I tried to say earlier, our responsibility is to push back, to say to the community, yes, we have our responsibility, but you have a part to play as well, because I don't think that there is a good enough understanding as yet, from our population as to what their responsibilities are. Mm-hmm. So to answer your question, what you would get is, well, what are you doing to control dengue? What are you doing to control chikungunya? Mm-hmm. Which we can answer to a certain extent. Mm-hmm. And then we push back and say, well, we can do so much, but now if you are not also involved in what we call source reduction, removing containers from your premises, then our involvement is sort of diminished because we cannot achieve the results without your involvement.
That's true. Now,
I was going to say too that part of it has been some reluctance on people to actually believe that this little tiny mosquito could actually inflict such body pain and stuff. I've had people say that, you didn't buy into that too, that it's really the mosquito, right? And I'm like, but it is, Mm-hmm. So there's some education that needs to go on, and that's happening through the community meetings.
Yes. Now, in terms of the numbers, where are our target areas? Which areas within the BVI have the higher concentration according to your indices?
Well, right now, Virgin Gorda. Okay. I mean, we have it really, really bad in Virgin Gorda right now, and both with dengue and chikungunya, as a matter of fact. So we have the two viruses circulating. In the case of dengue, it might be more viruses, because remember, there are 4 viruses that can transmit dengue. But basically, you have dengue and chikungunya circulating in Virgin Gorda. By far, Virgin Gorda would be the primary problem area right now. And that is why we have a daily presence on Virgin Gorda. It's going into 2 weeks today that we have inspectors there daily, both from the vector control unit that I manage and the environmental health officers providing technical support. Now, prior to that, as we've mentioned before, Joes Van Dyke, you still have cases coming out of Joes Van Dyke, but it's not as bad as it was last December and earlier in the year. We have a problem area right now in Carrot Bay. Carrot Bay. Carrot Bay has developed as a problem area. I was going to say Seacoast Bay. I sometimes get mixed up between Seacoast Bay and Carrot Bay, but actually both communities are having a problem right now. Mm-hmm. So we have our inspectors in Carrot Bay, as of Wednesday, and they'll be continuing next week. By next Monday, we hope to have covered the entire locality from Carrot Bay to Zion Hill and Long Bay, Smuggler's Cove, that area. Mm-hmm. So we have Carrot Bay and we have Seacoast Bay. Now, we also see a lot of cases coming out of East End. Not so much Long Look, but East End. So I'm beginning to see cases in the Major Bay area and further into East End towards the Sound. Mm-hmm. So we are thinking that as of next week, we're going to have to move our inspectors into those areas, particularly in the East End area, to begin tackling the transmission that is taking place there.
Yeah, thanks, Natasha. I'd just like to add, coming out of the experience from Jos van Dyke as well, in addition to the issues around houses, which are containers, cistern covers, gutters, etc., what we found in Jos van Dyke was derelict vehicles was a big issue. So we found a number of derelict boats which were trapping water and which had active mosquito breeding in. There were also some community cisterns which were uncovered. So, right, so in addition to what happens around households, there were actually some stuff in communities as well that was contributing significantly to mosquito breeding. And I would think in some of the problem areas that we have right now, that Mr. Mitchington just described, in addition to high container indices around houses, we also have issues in the communities with derelict vehicles, uncovered containers, maybe even some engineering issues with the drainage on roads, etc. And our experience has been, once we have a weather system pass through the territory, invariably within the next 3 weeks, the Environmental Health Division is extremely busy combating mosquito breeding. So it's imperative for the population to understand, particularly when we have systems moving through the territory, that we are going to have mosquito breeding. And around those times, we need to be extra vigilant about what's going on in our communities and around our homes as well.
And also, too, we can put the onus on each other. As a community, we live in little villages. We more or less know everybody around us to help each other. Now, my question, I know you conduct premises-to-premises inspections, and I know sometimes you come across a home that, elderly people may reside in there. Now, if you should happen upon one of those homes, and you have elderly people living there, and their premises is found to be a problem, how do you help them? In terms of if their yard needs to cut, is this something that, do you cut the yards? I mean, how do you help these particular cross-section of people?
That particular aspect of our work is not sufficiently developed, whereby we would find what we call high-risk premises and refer to other agencies. It's not highly developed to that point. We just haven't developed the protocols for that sufficiently to be able to say to maybe, social development that we have this individual who's elderly and who cannot help himself or herself, and maybe you might want to lend some support to have certain issues taken care of. But certainly from the standpoint of they having premises with mosquitoes breeding in whatever, we would help to the extent of treating those containers, and you'd be surprised that quite a number of the elderly people have, through certain government programs, caretakers, who will be able to assist them. I don't know whether it's on a daily basis, but we have interacted with these care people, who will take our suggestions and our recommendations forward to whomever to help these elderly folks. So that is as far as we can go right now. But certainly your question is valid. We need to develop the protocols whereby we can refer problems appropriately.
Now, coming back a bit, Dr. Georges, as we were referring to the vulnerable population, does this virus affect the elderly, or do we have any vulnerable population when it comes to chikungunya?
Yes, thanks again, Natasha. Definitely, both chikungunya and dengue can affect the very young, pregnant persons, women, the elderly, those who have illnesses such as arthritis, diabetes, hypertension, other chronic diseases. Of course, those persons can be more severely affected by the disease. So it's important for those persons in particular to help to protect themselves and to be vigilant that, if they do become ill, that they may be they may require health attention.
Now, while attending one of the community meetings, actually the one in Carrot Bay, we had Dr. Hastings speaking at length about the pregnant woman to child risk. I don't know if you could speak a little bit to that in terms of if a pregnant woman is bitten, according to the studies, by a chikungunya-infested mosquito and she's actually in labor, what are the ramifications? to her newborn child?
Yeah, definitely there's risk of mother-to-child transmission of virus, particularly when the baby is being born. So there is risk of mother-to-child transmission of virus. I mean, we would think that in our hospitals, persons will not be as exposed to mosquitoes. So it should be not, minimal risk here in the BVI. But definitely, as I mentioned before, persons who have chronic illnesses and pregnant women, again, are a risk group for these diseases.
Now, what particular advice can you give them, this particular cross-section of persons, that will help them safeguard themselves?
Right. It's the same advice we'd give to anybody, to any and everybody. Protect yourself. The mosquito tends to bite mostly at dusk or on dawn. The mosquito does bite throughout the day, but more so at those times. So if you must be out at that time, you can use mosquito repellents, long clothes, etc., to reduce the risk of being bitten. And if there is someone who is infected or who has the disease in the household, that person should take extra effort to protect themselves during the first week of illness. So that could include, again, using mosquito repellents, but then also sleeping on the bed nets to reduce the risk of mosquitoes biting that person. Other things around the household would be, ensuring insect screens are in place. The same discussions we've been having about mosquito breeding.
No. Congratulations thus far on your meetings. I think it's actually a great idea and a good way to interact with the community and bring the fight on their level. As we continue to try to encourage persons to play their role, I'll allow you this time now to convince everybody. I will start with Mr. Minchington. Tell persons why they should join this fight and how important it is for this collaboration in order to reduce the impact of chikungunya as well as dengue within the territory.
Okay, thank you for this opportunity. Well, as I mentioned in short earlier, the life cycle of the Aedes aegypti mosquito does not permit for any government agency like ours, or any government agency for that matter, to manage the production of mosquitoes on private premises or on business premises as well. So therefore, we require that the population puts a first foot forward by developing the habit of inspecting their premises once a week. Because we think if that is done, they will identify breeding places or potential breeding places, and we can supply the pamphlets and the checklists that will help people to determine how to manage a particular container if they cannot do it on their own. And of course, we're always there to provide the backup. I mean, if someone calls into the office and makes a complaint, as we call it, says that I have a mosquito problem, we are bound to respond. So it's not that we are reneging on our responsibility. It's just that the transmission of the virus has a particular window, a very, very small window. And if the population does not put that first foot forward to eliminate breeding grounds from their premises, then we'll not be able to break the cycle of transmission. So it is a problem of time. And so we are exhorting the population to get involved in the fight against the bite, as it is said.
Thank you. Mrs. Penn?
Yes, thank you. Ultimately, the outbreak affects everything. It's kind of like a domino effect. You get sick and you can have an impaired quality of health for weeks, months, years, which could ultimately affect your attendance at school or work, which ultimately would impact tourism. You can't go to work, you can't service people that need service. So it's a domino effect. So it's very important to impact this, the spread of this. And like I said, it can be very debilitating, and I especially, my heart goes out to young people and the elderly that would have to suffer. And it's something that is within our control to change, and we just have to get involved and do it.
Okay, thank you very much. Dr. Georges?
Right. To reiterate what everyone has already said, I mean, chikungunya is a serious disease with potential long-term side effects. There are also, as Ms. Penn alluded to, potential impacts on our economy with tourism. And the control of the disease is as you know, it's all related to the mosquito and controlling mosquito breeding. And the mosquito lives very intimately with us. As Mr. Mitchington mentioned, it's very difficult for the government to intervene. So it's imperative for the population and persons and communities to stand up and, as he said, fight the bite.
Mm-hmm. Well, thank you very much for joining the program. And we want to encourage the greater community at large, especially those living on the western end of the island, that there will be a community meeting on September 30th at 7:30 at the West End Community Center. So if you live on the western end of the island and you didn't have an opportunity to get to the Caribbean meeting, there's another one in the district, as well as on October 2nd at the Valerie Thomas Community Center at 7:30. So we encourage all persons to come out and take part in the public meeting as we try to work together to combat the effects of chikungunya and dengue. I want to thank you again for coming on the program, and thank you for allowing our public this opportunity to hear what's going on, to better understand the role of each department and ministry, and to better understand the role that they need to play in this fight. So thank you again, and thanks for tuning in.